Hydrocephalus. A brief presentation for medical students. Definition: Hydrocephalus is the accumulation of CSF in the brain ventricles, leading to increased intracranial pressure and ventricular dilatation. Usually, there will be CSF present in the ventricles, but when there is increased accumulation of this CSF in the ventricles, this leads to hydrocephalus. Maybe this is due to decreased drainage or increased production. Causes for these may be congenital causes or acquired causes. Congenital, neural tube defects or aqueduct stenosis, where there is obstruction in the aqueductal. And then acquired causes can be tumors, trauma, hemorrhage or infection like meningitis. There are three types of hydrocephalus: communicating hydrocephalus, non-communicating hydrocephalus or normal pressure hydrocephalus. In communicating hydrocephalus, CSF is not absorbed properly. CSF is not absorbed properly, so there will be increased accumulation of CSF in the ventricles. In non-communicating, there will be obstruction. CSF the flow is obstructed, so everything will accumulate in the ventricles and causes hydrocephalus. In normal pressure hydrocephalus, where the pressure is normal but ventriculars are dilated and the CSF is accumulated, more CSF, so more pressure. So it causes hydrocephalus. And coming for the symptoms, in infants the symptoms are different and in adults the symptoms are different. In infants there will be increased the size of the head, enlarged the head, bulging frontal eye. Frontal eye is not fused. When there is increased pressure inside, it bulges out. And then sun setting eyes. This is eye. Sun setting means the pupil and everything will come down. So this is the eye appears like this. So this is sun setting eyes seen in the infants with hydrocephalus, and you can see irritability or poor feeding in the children. In adults, headache, vomiting, then vision problems and gait disturbance and cognitive decline. All these are the symptoms in the adults with hydrocephalus. Then coming for the diagnosis, how you will diagnose with the hydrocephalus. You have 6 techniques. First, ultrasound in infants via anterior frontal eye will do ultrasound and then observe. Then CT scan, a quick review of the enlarged ventricle can be seen. This is for normal pressure hydrocephalus. And brain MRI, detailed CSF and brain structure can be visualized by the MRI scan. And lumbar puncture for normal pressure hydrocephalus. And head circumference in infants with the hydrocephalus we see, and intracranial pressure monitoring to check the pressure inside the skull. We will do all this to diagnose hydrocephalus. Next, coming for the treatment, how you will treat. There is a problem in the drainage, so there is obstruction in the drainage, so VP shunt you will do, that is ventriculoperitoneal shunt, in order to drain the CSF. And endoscopic third ventriculostomy, ETV, which creates bypass for CSF flow. Then you will monitor the head signs and neurological signs, that is headache, this visual disturbance and all there or not, in order to prevent that hydrocephalus, like to monitor the hydrocephalus, the progression of hydrocephalus, and treat the underlying cause like infection. If there is an infection or tumor, you will treat that, so in order to prevent the hydrocephalus or increase the intracranial pressure. This is the concise or brief presentation of hydrocephalus. If you find this video helpful, please do like, share, subscribe to my channel. If you have any suggestions, let me know in the comment section. Thank you.